A mother makes a desperate call to the emergency services. In mid-April, a 2-year-old boy nicknamed En tested positive for COVID-19 and had a high fever. His parents contacted the emergency services. But it took 3 calls and 81 minutes before an ambulance arrived at En home in Zhonghe, New Taipei City. 6 days later, En died of brainstem encephalitis. The hospital says he suffered from septicemia triggered by the COVID-19 infection. It was the first COVID-19 death of a person under the age of 30 in Taiwan. On Tuesday, local media revealed the telephone conversations between En's parents, emergency services, the health department and the local hospital. The boy's father is now asking why the hospital initially refused to admit the boy, and how calls from the emergency services to the health department went unanswered.
陈润秋局长，你的卫生局在干什么？侯友宜市长，你不用出来说明吗？这真的是官僚杀人！我花了22天，我没有办法从正式管道新北市政府提供给我，我既然要透过媒体、透过吹哨者的爆料，我才有办法一窥全貌。
At the center of the controversy, a now shelved policy by New Taipei City which required health department approval for ambulances to be sent to pick up COVID-19 cases. The city's health department has said all materials have been passed to the judiciary for investigation. And on Wednesday, the city's mayor apologized.
这一次，我也会自我反省、检讨、负起全部的责任，并且再一次的检视全部的过程，并配合司法机关的侦办，没有人例外。
Taiwan is in the midst of its biggest outbreak since the pandemic began. Many have raised concern about the rising cases of child infections since the start of this latest wave in April. More than 60 children aged 12 or younger have developed severe COVID-19 infections. Nearly 20 of them have died. On Wednesday, Taiwan began another round of vaccinations for children aged between 5 and 11. That's a day after it announced it was negotiating a deal to purchase Pfizer-BioNTech vaccines for children aged 6 months to 4 years old. They're measures the authority hope can also help to prevent another tragedy. Karma Shu and Rick Glauert for TaiwanPlus.